Aspen Medical is a health provider from Canberra, proving health services can deliver healthy returns. The company was set up in 2003 and has contracts all over the world now, including with the Australian Defence Force, CSIRO and across the oil and gas industry. You could call it an export success story. Co-founder Glenn Keys, who's also on the board of the NDIS, sees only opportunity in the healthcare space. Glenn Keys, the services sector in Australia is expanding. It's benefiting in part from a lower dollar. What are the opportunities for Aspen?
What we find is that Australia and its service sector are incredibly well regarded, be it in health, financial technology, mining support, life services sectors. They are all really well regarded, and just being an Australian company in the health sector allows us to open doors. We're seeing our growth, particularly in the Middle East, the US and the UK, will soon be a greater component of our total revenue than our work in Australia.
One of the contracts Aspen's just got is a $20 million 4-year contract to provide healthcare to remote Indigenous communities. Is this the future of how we provide healthcare to these communities?
I think it's very clear that this is a component of what Indigenous health needs. This isn't the only answer.
Does it need more money though? $20 million isn't much when you consider the costs.
We're certainly doing enough, I think, in this area, remembering that this is not about complete Indigenous care. We're about providing those solutions where people are on leave, training and during recruitment periods. So there is a much broader Indigenous health pack. We're just around providing a component for it, and certainly it's shown to be very, very successful.
You have a huge need for staffing, but how do you go recruiting, because health providers across Australia are crying out for staff?
I mean, part of the reason we're in business is because there is a high demand for health professionals, particularly Australian health professionals. They're well regarded around the world. But to give you an idea, when we did the Ebola response, we had 1,200 people apply in the first 2 weeks. So we've got a database of over 5,000 people.
Does this present an opportunity to Aspen? Hospitals are constantly complaining about being understaffed and overstretched.
We typically go in where there's a problem. So, for example, we've done work in the UK where we cleared massive surgery waiting lists in orthopaedics, urology. But once we'd corrected those problems and helped them institute new systems and more efficient ways of work, they were able to then cover and move on themselves within the normal parameters of their employment. I think that may be a real opportunity for us when we work closely with customers, be they federal government, be they private hospital operators, or be they even Indigenous health. We're able to introduce a lot of efficiencies, give those to them, get them learning those and operating those new skills, and then we can withdraw and they can then carry on within a public health system.
Like what? Where do you see the waste?
Oh, it's not so much waste, it's what we're learning. We're learning new systems of how to better integrate technology, how to better process patients through an ED, how to minimise rehab time. There's also been a number of reports out around how we can minimise rehab time, how we can minimise time in beds for patient post-operations, how we can improve operations so we're not, say, for example, laying open a hip, but we can do more keyhole surgery. As we integrate those procedures, we'll get more and more efficient. And it's around learning and then instituting that learning and working out the best way to apply it, because how you apply it in a major metropolitan hospital might be very different to how you apply it in a rural hospital.
You're on the board of the National Disability Insurance Scheme. It's about to be rolled out in New South Wales and Victoria. Is it going to be the jobs and economic boom that it's been touted as?
Certainly there's been a lot of reports about that. We know that that's going to be an increase in staffing. The chair would typically talk to this, but right now we are certainly on scheme. We're on track, we're on budget, and the satisfaction rate from people out there using the scheme is really high, which is just fantastic. So I think there is a real opportunity for us to see not only growth here, but for businesses to learn what it is that the NDIS is doing, how to better apply that system, and then take those learnings not only around Australia, but overseas.
So what is the business opportunity?
Well, I think this is exciting because I think it can be any business. If you have a look, we've got some exciting things happening. Aged care, health, disability. I think it's a great opportunity to look and work out And I think the way that we're going to satisfy the need around aged care health and even disability in the future will be businesses that have never even considered themselves supporters of those sectors.
The federal government and the states are in heated disagreement over the future governance of the NDIS. The current board that you sit on has been extended, but then there's no clear agreement on how a new board will be elected. So who do you think should be running the process?
I'm not really sure that I can talk to the government's decision on that. The Disability Reform Council are responsible for that. It's the various disability ministers from each of the state and territory and a federal level, and I think it's appropriate that they make those decisions, and they've made good decisions in the past. I have no doubt they'll make good decisions.
Glenn Keys, thank you for your time.
No worries, thank you.